Welcome to the Front Street Animal Shelter, located in the heart of downtown Sacramento, California. Every year, over 11,000 animals come through these doors. Dedicated staff and volunteers work hard to provide quality care to these animals. Each and every one has a unique story to tell, and there's always so much to learn. We'd like to explore and share some of the real-life experiences of both the animals and the humans that can be found here in A Shelter Life. Hi, and welcome to Shelter Life. I'm Don Hinkle, and I'm your host. This episode is going to focus entirely on veterinarian care at Front Street. And tonight, our special guest is Dr. Warner. Dr. Warner, thank you so much for joining us.
Oh, I'm glad to be here tonight.
A lot of people probably think lots of different aspects of veterinarian care for a city shelter, but before we get into that, just tell us a little bit about your background and your experience.
Well, I was in private practice for several years before I came to shelter medicine, and I've been actually working at the animal shelter for 12 years now.
Wow. So prior to the animal shelter, I understand you were in nursing, is that true?
Well, actually, I was a nurse before I became a veterinarian, yes.
And what got you into the veterinarian field? What pulled you in that direction?
Well, I wanted to continue my education, but I didn't want to be a physician. So I decided I'd rather be a veterinarian.
And we obviously have a guest with you tonight.
Yes, this is Bella, and she's a dog from the Front Street shelter that I adopted.
You know, I think a lot of us who volunteer and work at Front Street are what we call foster failures.
Yes,
And
yes.
I'm one too, so that's all right. Welcome, Bella. So a lot of people probably have a misconception on what a shelter veterinarian does versus a private practice veterinarian. So can you kind of explain maybe the differences of those two?
Sure, it's quite different. The private veterinarian has a client come in that has the pet, and they treat that one pet at that time. The client has to okay everything that's done. There's money exchanged, and you look at one animal at a time. With shelter veterinarianism, it's a little bit different. You look at really the health of the whole entire shelter. It's sort of like a herd medicine.
Okay.
So you look at vaccines to keep them all healthy. You look at protocols for cleaning to keep everybody healthy. And you look especially at contagious diseases that could spread through the shelter.
So is that when we have, on average, Gina was on the show previously, and she was talking about on average about 10,000 animals
Right.
come through the doors of Front Street every year. Do you physically inspect all those animals?
Not when they come in, but usually during the course of their stay, I see almost all of them. So if they're injured at the time they come in, then I see them immediately.
So is it kind of like, do you guys kind of like have like a mobile MASH unit? So
Well, it's sort of like that, yeah. Uh-huh.
So like there's the triage and the ones you see immediately first. And
Right, right.
So is there always somebody on staff at Front Street?
Yeah, during the day, we have a veterinarian there 7 days a week.
Wow. So what are the most common issues or maybe health issues that you see of the animals that come into the shelter?
Most of the time, it's like skin issues. They have hair loss. We see a lot of hit by car animals, unfortunately. You know, those are the big main ones. We have some that have come in with bite wounds that we have to treat.
So when an animal is brought in, like from an animal control officer, or and they have a broken leg, is that something you can actually take care of right then on site?
Well, what we usually do is assess the animal's condition, make sure we keep them comfortable, start them on pain medications, antibiotics if they need it. Then, depending on the temperament of the animal, we'll send them for x-rays. And then UC Davis does a lot of work for us to get bones repaired for free.
So how did that partnership develop between Front Street and the veterinary clinic at UC Davis?
Well, I mean, I've been associated with the shelter medicine program there ever since I started at Front Street. And then I learned they started like a community surgery clinic where the senior students do some sort of easy.
It's like an internship sort of thing?
Well, it's a rotation the seniors go through so that they get a chance to do more surgeries before they graduate. So they'll do soft tissue surgeries, mass removals, eye removals, you know, some spays and neuters for us. But there's also a grant through UC Davis where they'll do orthopedic surgeries for shelter animals. So if I have an animal that has a broken something and it's very adoptable, I send it over there and they'll actually fix those fractures for free.
That's incredible.
Yes.
So we all know about the fund that comes from the Friends of Front Street. And a lot of it is for those animals that may come into Front Street that need special care.
Yes.
I mean, I could list of a couple of them immediately, but the one that comes to mind probably most recently was, Hope.
Hope, yes.
And can you tell us a little bit about what Hope's situation was when she came to us, and maybe if you have an update on how she's doing now?
Well, Hope had Demodex when she came in, a very common mite that lives in the hair follicles of dogs. And certain types of breeds, the mites flourish, and especially if they're immunosuppressed or don't have a good immune system, and it causes hair loss, and then it causes actually an infection in the skin. So that's where Hope was when she first came. She had a lot of hair loss, and she had infection on her skin, and her eyes were all swollen, and she was pretty miserable and pretty thin. So we, diagnosed her by skin scraping, and then we started her on antibiotics. And in the very beginning, she had a real large ulcer on her eye, and eventually, unfortunately, that eye ruptured and had to be removed. And that's what the money went to pay the emergency vet to do that, because it was in the evening on a Saturday.
So you've been at Front Street for how long?
12 years.
So have you seen a difference in the last 3?
Oh yes, yeah. We're doing more medical treatment, we're adopting out more animals, we're treating some animals that we never used to treat before, like maybe a cat with high thyroid. We never used to treat those before, and now we're starting them on on medication, and they're getting adopted. We see a lot of pit bulls with Demodex. We see a lot of broken legs.
One of the questions we've asked a couple of people, if you could ask a vet any question, what would it be, right? And one of the questions that came up was, do you have a favorite animal that comes into the shelter? Has there been one animal that just stands out in your mind as a really special case that you will never forget?
Oh, well, I have several of those. Yeah.
Want to tell us one?
And well, one time we had a border collie that came in and had a horrible wound on his neck. And his temperature was like 104, which is really elevated. But he looked at me and he wagged his tail. So he wanted us to save him.
Right.
So it took several weeks to get the wound healed up where we could close it. And then he did go to a rescue for border collies.
So speaking of rescues, I know that you work pretty close with Lori Rhodes and Samantha Bergen, the foster coordinators. What is your perception, or what role do you play as the shelter veterinarian when it comes to actually maybe helping decide or giving recommendations on the animals that maybe need to go to foster? What determines that for you?
Well, a lot of it determines on how long it's going to take for their particular problem to resolve. Something with a broken leg, after they get that leg fixed, it's going to take 6 to 8 weeks before they're really well enough to go up for adoption. So they can't stay at the shelter for 6 to 8 weeks, so they go to foster care. Another thing, we look at if they have multiple medical problems. Lori and Samantha tend to work with me more on their behavior. Is this an adoptable dog? I work more on, are we going to be able to fix the medical condition before the dog can go home or be adopted?
And all those medical costs for the foster program is still covered?
It's still shelter medicine, yes.
Yeah. So one of the things that obviously you're probably pretty proud of is you got a brand new facility.
We did.
And for those of you that don't know, we're actually going to go have a little cutaway here in a minute and let you actually see a tour of the medical building at Front Street. But prior to this great new facility, can you tell us about where you had to actually do your medical work at Front Street?
For 11 years, I was in a trailer, about 8 feet wide and 20 feet long.
Yeah, pretty small.
Yeah, and we did, 10 surgeries a day, usually 5 days a week because we didn't have as much staff then. And one technician and me did all of that in a very small space.
I remember the first time I saw that trailer and they told me, that's where they were doing the procedures, and I said, you're kidding me, But the new medical facility is phenomenal, and I've definitely poked my head in there a few times. But can you tell us just a little bit about it?
Well, it's much bigger, for one, and it's actually a building. It's not something on wheels that breaks down every time you tow it somewhere.
Right.
It has 4 surgery tables, so we can do up to 4 surgeries at a time. We have about 20 cages in there right now to hold animals. We have our own scale in there. We have a big treatment room. And we have a full-size refrigerator rather than a small refrigerator. And we actually have offices for the doctors and the technicians in there too.
How many veterinarian technicians actually work in the med building with
Well,
you?
we only have one that is a full-time city employee. And then we have another RVT that's a contract employee, and then we have several assistants that are contracts. And then we have some volunteers too.
So recently, what was it, National Spay and Neuter Day?
Oh, Spay Day?
Yeah, Spay Day?
Yes.
How many procedures did you actually do that day?
We did 20 large dogs that day.
That's a lot, isn't it?
Yeah, it's pretty big. It's a lot when you're big dogs.
Right.
Yes.
So we're going to do a brief cutaway. We're going to actually let you guys see the inside of the new medical center at Front Street. So have a look. Okay, so we're actually inside the med building right now, and Cynthia's going to give us a little bit of a tour right around exactly what we're seeing. Take it away.
Okay. All right, so in the morning before surgeries, what we do is we pull the animals from the kennels and we put them here. And then what we're in the process of right now is we are pre-medding the animals, so we're getting all their pre-meds and their drugs all set up and ready for surgery. After that process is done, and the reason why there's towels is because they sometimes they get too excited, and so we need to kind of settle them down, and that's why we put the towels up. So after that, what we do is we bring them in here. This is our prep area. So we will bring them here and we set them up on anesthesia where we clip and clean and we shade their surgical site and get them ready for surgery. After that process, then we come here to our surgery area. And in here, this is where we actually do our surgeries. So at this point, we put them on the table, again, we hook them up to the anesthesia machine and we set them up with the monitors, and then the veterinarian does our surgery.
So do you usually have all 4 stations going at the same time?
We try to have 2 veterinarians here,
Okay.
so yes, we do. We go back and forth between the tables. So one veterinarian has this station and the other veterinarian has this station. So we go back and forth, and so in that way we are able to do more surgeries and it's more efficient that way.
On an average, let's just say medium-sized dog. How many can you do in a day now?
Medium-sized dog, we can probably do between 10 to 14.
Okay, great.
Okay, and then after surgery, then we put them back in their cages for recovery. So then we set them up with heating pads and we monitor them during their recovery.
So are you doing a lot of kittens right now?
Yes, it kind of varies, whether or not it's kitten season or not. We do send some out we outsource some of our kittens, which is really helpful. All right, so these are our new blood machines. It measures blood chemistry and complete blood cell count, CBC. We used to outsource this resource until we got these, but this is wonderful. We're actually able to do it in-house, and we get the results within 10 to 15 minutes, so it's highly functional.
So in the past, we had to send that out to separate labs, private labs?
Yes.
And how long was the turnaround time on that?
24 hours.
Okay, so this is a lot quicker.
A lot quicker, a lot more efficient.
And this came from one of the fundraising events with the Friends of Front Street?
Yes.
Right.
Yeah.
So the building is absolutely incredible, and the cleanliness of the building, obviously you guys take a great deal of pride in that
Yes, we
building.
do.
And it's nice that